Welcome to the Spanish for Medical Professionals. Hi, this is Dr. B. This is one of the bonus lectures that we are having in Spanish for Medical Professionals series. Right now, we are going to talk about the numbers that we use in medicine, the numbers that we use in healthcare. Let's start it. I put it here on a slide showing you a couple of the YouTube videos that I think they are going to be important for you. Of course, I'm not going to start teaching you the numbers because that is not part of the curriculum, but you can watch this one here. So I've been seeing a couple of them, and I think these are the ones that they are going to help you the most. In the upper left-hand side, there is a video about the numeros. It's more for children probably, so if you are completely brand new to Spanish, that probably is one of the videos that you may watch. The problem with this one here is that they have a lot of Spanish narrative. So there is going to be moments that you feel lost completely in that. The lower left-hand side here is just also for children. So if you are completely new to the language, this could be a great for you. I like it because it has a lot of pronunciation and visual activities. It's for kids and for adults, but just go from 1 to 10. If you are already a little bit more medium level in Spanish, probably the upper right-hand side could be good for you. She's very good. She speaks good English, and so she has a good English narrative. The only problem that I notice is she goes a little bit fast, so most likely you have to see in a 0.75 times the speed of normal, but that has a very, very nice grammar and pronunciation. And one of the I like the most is the one in the lower right-hand side. It's called Spanish Lessons. I don't remember his name, but it's very easy to find him in YouTube. He counts a number from 0 to 100. Also, I will advise you to watch the lesson slowly because the pronunciation is very important. I think it's an excellent for adults. It's a little fast, the ones in the right-hand side, a little slower in the left-hand side, more for adults in the right-hand side, more for children in the left-hand side, and a little bit more at medium level in the right-hand side, and a little bit more basic level in the left-hand side. So there is hundreds of them. Pick one, start learning your numbers, start learning the pronunciation, and let's start our lesson in how we are going to use the numbers in our medical field, in healthcare. So how we use the numbers in Spanish for medical professionals? We used to describe how many pills we have to take, numbers of tablets of pills, the milligrams or the doses of the medication, the insulin units that we are advising to our patients, maybe the time of the appointment that we are waiting for the patient, the time of the medication, the floor of hospital or the floor in the clinic where some department is located, the phone numbers of our offices or colleagues or the other appointments like physical therapy, radiology, so forth, and the attention hours of our clinic. So let's start. Comencemos. So the number of tablets. So sometimes you discharge the patient and you have to tell the patients how the patient is going to take the medication. So if you are a nurse practitioner, a physician assistant, a doctor, a medical assistant, this is a very, very frequent situation. Let's see, a patient is with you and you have to explain how many tablets the patient has to take it. That's what you are going to say. Tomar. Tomar means take. Tomar dos cápsulas en la mañana, en ayunas, y 3 cápsulas en la tarde. So let's translate that. What's tomar? Tomar is take. Take 2 capsules in the morning. Remember the previous lesson? In the last week lesson, I explained you the difference between mañana, that is tomorrow, or mañana, that's morning. Let me do it again. So mañana in Spanish means 2 things. Means, let me see if I can find the letter N. Well, mañana can be morning, but also mañana can be tomorrow. So we have to explain the patient about that. If I want to take the pills in the morning, I'm going to say en la mañana, tomar 2 cápsulas en la mañana. If I want the patient just to take the capsules tomorrow, I said tomar 2 cápsulas mañana. You don't say it en la mañana because en la mañana means in the morning. So hopefully that is clear. Tomar 2 cápsulas en la mañana means take 2 capsules in the morning. En ayunas means fasting. And remember the letter Y, and 3 capsules in the afternoon, en la tarde. So you are telling the patient to take 2 capsules in the morning, fasting, and 3 capsules in the afternoon. Another example here. Tomar, you know what's tomar? Take. Tomar una cápsula en la mañana todos los días por 5 días. So what I'm saying here, tomar means take. Take 1 capsule. En la mañana we learned already. Take 1 capsule in the morning. Todos los días means every single day. Todos los días. Por 5 días. 4. Por 4. Por 5 días. For 5 days. If, for example, you are prescribing an antibiotic and you want to take the patient just 1 in the morning every day for 5 days, that's the sentence. Tomar una cápsula en la mañana todos los días por 5 días. Now, I want you to listen what I'm going to say. Let's start working on a little bit of listening exercise. I'm not going to say anything, but I'm going to use the structure of this last sentence here. Listen what I'm saying. Tomar 2 cápsulas en la tarde todos los días por 10 días con comida. Con comida means with food. If you want, you can just post in the comments what did you listen, and I will be more than happy to read it and comment it. Next one here. Another example when we use numbers in medicine, when we talk about the milligrams, when we talk about doses. Let's read this. What's happening here? Follow me. Buenos días. Soy Jorge Serrano. Necesito el refill de mi medicamento. And somebody is answering that phone and saying, buenos días, soy Sally, soy la enfermera del doctor Sfmp. ¿Qué medicamento necesitas? And he is answering back, necesito losartán de 50 miligramos y metformin de 850 miligramos. And she started looking in the chart and she's like, wait, pero tú estás tomando losartán de 100 miligramos, no de 50 miligramos, ¿verdad? So let me tell in English what's going on here and we can go back to the Spanish here. So, buenos días, soy Jorge Serrano. Good morning, I am Jorge Serrano. Necesito, yo necesito. I need el refill de mi medicamento. I need the refill of my medicine. And somebody's answering and said, good morning, I am Sally. I am the nurse of Dr. Sfmp or Dr. Sfmp's nurse. Soy la enfermera, yo soy la enfermera of who? Del Dr. Sfmp. And she's asking him, ¿qué medicamento necesitas? What medicine you need? What medicine you need? And he's saying, necesito, I need, necesito losartán de 50 miligramos. I need losartan 50 milligrams and metformin 850 milligrams. And she's looking in the chart and she's going to say, but you are taking losartan of 100 milligrams, not the one that is 50 milligrams, right? And look at her face, right something is going on here. I don't think this is just something that we don't see. I think we see that a lot, that the patient thing is taking some milligrams and in the chart is a different thing. Somebody didn't change in the chart. The patient maybe doesn't know. There is an issue here. So that is important. That's why it's important for you understand what the patient is saying in numbers. He is saying 50 miligramos, but in the chart you are reading 100 miligramos, and he needs 2 medications. So let me ask you a couple of questions here. What's the name of the patient? Jorge Serrano. What is the name of the nurse? She's Sally. Which doctor sees Jorge Serrano? Dr. Samper. And why Jorge is calling to the doctor? Because he needs medication. Necesito el refill de mi medicamento, because he needs a refill of the medication. And the nurse says, what medication you need? So which medication is Jorge Serrano taking? He's taking losartan 50 milligrams and metformin 150 milligrams. So what issue is happening here? One thing is in the chart, one thing is what Jorge is asking for. Which medication, how many milligrams is in the chart? Losartan, 100 miligramos. Which medication, how many milligrams is Jorge taking? 50 miligramos. Okay, so let's go to the next slide here. Unidades de insulina. That's another very, very important aspect in our daily life that we need the numbers. So listen this conversation here. Buenos días. Yo soy, buenos días, soy Ron Rodríguez. Yo perdí las instrucciones. I lost the instructions. ¿Cuánto de insulina necesito en la noche? Somebody's answering the phone and said, buenos días, Ron. Soy Jasmine, la enfermera de endocrinología. Necesitas 50 unidades de insulina basal en la noche y necesitas 10 unidades de insulina rápida con las comidas. ¿Está claro? Sí, gracias. Chao. So let's go back and let's see what's happening here in English. Follow the pointer. Good morning. I am Ron Rodriguez. Buenos días. Yo soy Ron Rodriguez. I lost the instructions. That is very common too, right? So I think everybody will feel the pain right now. Yo perdí las instrucciones. I lost the instructions. ¿Cuánto? How much? ¿Cuánto? Remember, try to remember this. ¿Cuánto means how much? How much insulin do I need at night? And the nurse is answering. Buenos días, Ron. I am Jasmine, the nurse of endocrinology, the endocrinology nurse. You need, necesitas, you need 50 units, 50 unidades, 50 units of insulin. What type of insulin? The basal insulin. En la noche, at night. So this sentence is, you need, necesitas, 50 units of insulin. Which one? Basal insulin. En la noche, at night. And you need 10. You need 10 units of insulin. Which one? Rapid. With the food. With the meals. Better say with the meals. Is it clear? ¿Está claro? So está claro we use in many things. When we are giving instructions to the patients and we want to be sure the patient understood, we said, ¿está claro? Or when we are giving a message or when we are teaching, we can ask our students, ¿está claro? I mean, it's okay. Did you get it? Did you understand? Did I explain correctly? We are in the same wavelength. We are understanding each other. Sí, gracias. Chao means goodbye, right? So this is very important. So you need to practice your numbers because situations like this are going to happen. So it is going to be very, very important. So I will recommend you for each slide, you can go back again and you just change the numbers and try to practice the same conversation, but instead of 50, say 30. Necesitas 30 unidades. Instead of 50, you say 20. Necesitas 20 unidades. Instead of 50, you can say 35. 35. Instead of 50, you can say the 62. 62. That's going to be a question for you. Necesitas 10 unidades. Instead of 10 can be 8. 8. Necesitas 15 unidades. 15. Necesitas 4 unidades. 4 units. Okay, so practice doing that. Next one. When else we do need to know numbers for healthcare workers? For the time of the appointments. So pretend that you are working in the front desk, or you are answering a phone, or you are the doctor and the patient is asking you about the next appointment. So listen this conversation. Buenos días, says this lady. Buenos días, yo perdí las instrucciones. She lost the page with instructions. How rare. Yo perdí las instrucciones. ¿A qué hora es la cita médica? ¿A qué hora es la cita médica? And look what somebody's helping is answering. Buenos días. La cita médica es a las 2 de la tarde. Juan, el día de mañana, jueves 24 de septiembre. So let's go back and see what's going on here in English. It says, good morning. I lost the instructions. Yo perdí. So what's perdí? Perdí is lost. What is yo? I lost the instructions. ¿A qué hora es? This is very important for you. Try to memorize this because you are going to listen that a lot. ¿A qué hora es my appointment? ¿A qué hora es my CT scan? ¿A qué hora es my vaccination? ¿A qué hora es the doctor in the office? At what time is? At what time is? And what's la cita médica? It's the medical appointment. And let's see what's happening here. Good morning. The medical appointment is at 2. What's de la tarde? De la tarde means in the afternoon. In the afternoon. El día de mañana. What's el día de mañana? Tomorrow. Tomorrow. And what day is going to be tomorrow? Let's see the calendar. Let's see which day is today. Let me remove one thing here. Let's see which day is today. Is Wednesday. So tomorrow is going to be Thursday. So what's jueves? Jueves is Thursday. And today is the 23. So what day is going to be tomorrow? 24. Which month? Septiembre. So go ahead also, get some YouTube videos for children and check the days of the week and the months, and that's going to be important. If you want to help a patient about the medical appointment, then you are going to tell them the time, the day, and the month. So at what time is the medical appointment? 2 de la tarde, 2 in the afternoon. When is the medical appointment? Is going to be el día de mañana, tomorrow. Maybe the sentence probably should have end there. It's tomorrow at 2, period. But I make it a little bit harder. Jueves means Thursday, the 24th, and September. Thursday, 24th of September. So try to do the same exercise, changing. Maybe pretend that today is the 30 and say, oh, it's going to be tomorrow, jueves 31 de septiembre. Or let's pretend that today is the 7th. It's going to be Monday the 7th. And you are going to say, the appointment is tomorrow, Tuesday, the 8th of September. Martes 8 de septiembre. Or maybe miércoles 9 de septiembre. You are looking at my pointer, right? Or maybe it's going to be next Wednesday, miércoles 16 de septiembre. So try to practice your numbers, your days of the week, and your month so we can do this exercise more fluidly. Another circumstance here, medication schedule, right? The patient sometimes asking about how they are going to take the medications, and we already did some exercise, but in this one, we are going to tell them exactly the hour when they are going to take the medication. And the patient is asking, ¿cómo tomo los medicamentos? How should I take? ¿Cómo es how? How? How I take the medication? Tomo means take. ¿Cómo tomo los medicamentos? And we are explaining tomar. Remember, tomar means take. Tomar 2 tabletas en la mañana. Remember, en la mañana is in the morning. But now we are going to be more precise. We are going to set the time. A las 6 de la mañana. Con el estómago vacío. So let me read it again. Tomar 2 tabletas en la mañana a las 6 de la mañana con el estómago vacío. Take 2 tablets in the morning at 6 in the morning with empty stomach. Vacío means empty. So I want you to pay attention in the same sentences we have been using mañana with 2 different meanings. Tomar 2 tabletas, we know is take 2 tablets. En la mañana means in the morning. A las 6 de la mañana, that is the specific meaning, is at 6 in the morning. And is with empty stomach. And what else happening here? Y, that means and, tomar 3 tabletas, take 3 tablets a las 8 de la noche. Take 3 tablets at. A las 8 is at 8 at night, p.m. De la noche. De la noche. Solo con agua. Only with water. Solo con, remember con is with, and agua is water. Only with water before sleep. Antes de dormir. You can tell the patient antes de comer, that means before eating, antes de dormir, before eating, before sleeping. So let's read it again. Tomar 2 tabletas en la mañana a las 6 de la mañana con el estómago vacío, with empty stomach. Tomar 3 tabletas a las 8 de la noche. A las 8 de la noche, that means 8 p.m. Only with water, solo con agua, before sleep, antes de dormir. Another situation that may happen when we have to tell the patient exactly the time, because we can say 1 in the morning, 1 in the afternoon, right? But some medication need to be taken specifically at some specific time. Like, look, this case here is a patient that is hospitalized, is admitted, and maybe the patient or a family member is asking you. Let's see what this patient is saying. Is hospitalized one. Enfermera, buenos días. ¿A qué hora es mi medicamento? Tengo dolor, me duele. Maybe the patient is asking you a pain medication. Tengo dolor, I have pain. Tengo dolor, me duele, it is painful. And maybe you answer, I'm so sorry, a las 2 de la tarde, because you are going to give a specific time. Or no, your test is not until 2 p.m. or not, your medication is not until 2 p.m. So you have to be very specific with times. A las 2 de la tarde. Let me read it again. Enfermera, buenos días. ¿A qué hora es mi medicamento? At what time is my medicine? And you are answering a las 2 de la tarde. So numbers are important, especially 1 to 12 for time, but when we need to talk with minutes, then you have to know everything at least until 59 or 60 minutes, 60 seconds. Let's see the next one here. When else is important? For phone numbers, the patient sometimes is calling and said, oh, The doctor didn't tell me the phone number where I need to call, right? Happens to you? Well, happens to me all the time. So the patient is calling the office and said, por favor, llama a radiología. Please call radiology. Por favor, llama. Llama means call. Remember, now we know a third definition of llama. In the first lesson, in the second lesson, we learned already two other definitions for llama. And let me grab my pen here. So remember, llama means fire. Llama is the llama, the animal. But also llama is the verb call. Call. Llama. Llamar is the verb that's not conjugated. Llama is already conjugated. So let me clear up everything here and let's go with the exercise. Por favor, llama a radiología. Por favor, llama a radiología para una cita de ultrasonido. So for what he needs or she needs to call radiology? For an appointment, for an ultrasound appointment. Para una cita means un appointment of what? Of ultrasound. Para una cita de ultrasonido. For the ultrasound appointment. For the ultrasound appointment. And then you are going to start telling the patient, call to this number. 847 123 4567 or to this other number 212-987-6543. So you have to be able to know your numbers if you want to give the patient a phone number by phone where the patient should be calling for an appointment. Or you can tell the patient, after you see the doctor, please call the pharmacy for your medication. Llama a la farmacia. Call to the pharmacy. For what? For your medication. Para tu. Para means for. Para tu medicamento. This number means to. 834-246-3579. I would like you to pick up some phone numbers from yourself, your family members, and try to practice your phone number in Spanish. You have to memorize, if you are going, for example, to a different country, the number of your passport in Spanish. If you go for Spain, Central America, Mexico, South America, you have to memorize the phone number of your embassy, maybe a phone number of your friend. So it's very important that you are going to be able to say it in Spanish. Can you say your phone number in Spanish? Let me go to the next one. Also, when we use this, we used to talk about the floors in the building to tell the patient where the things are located. But in this case, we are not going to use the regular numbers or call the cardinal numbers. We are going to use the ordinal numbers, are the ones that give us the order. So for first, we said primero. For second, we said segundo. For third, we said tercero. Fourth, cuarto. Fifth, quinto. Sixth, sexto. Seventh, séptimo. Eighth, octavo. Ninth, noveno. 10th, décimo. Let's see a situation here. Buenos días. ¿En qué piso es cardiología? And somebody's answering. Cardiología es en el 8º piso. Good morning. In which floor is cardiology? ¿En qué piso es cardiología? Cardiología es en the 8º piso. Cardiología es en el. Cardiología es en el 8º piso. Another situation here. Buenos días. ¿En qué piso es terapia física? Terapia física es en el primer piso. So, good morning. In which floor is physical therapy? Physical therapy is in the first floor. Good morning. Buenos días. ¿En qué piso? In which floor is physical therapy? Es terapia física. Terapia física es en el primer piso. So, on top of you know your regular numbers, or we call the cardinal numbers, you have to learn your ordinal numbers. Ordinal numbers here. So, next one here. Also, we use the numbers in Spanish for medical professionals when we are going to be talking about hours of attention. So listen this conversation here. Buenos días. Necesito una cita con la doctora Ambrosio. And somebody's answering. Buenos días. Mucho gusto. La doctora Ambrosio atiende de lunes a viernes desde las 8 de la mañana hasta las 4 de la tarde. Y los sábados desde las 8 de la mañana hasta las 11 de la mañana. Oh, gracias. So let's see what's happening here. Sentence by sentence, let's do in English. Good morning. Necesito, I need. What you need? Una cita, an appointment. With who? Con la doctora Ambrosio. Necesito una cita con gastroenterología. Buenos días. Necesito una cita con pediatría. Buenos días. Necesito una cita con ginecología. So we can change whatever at the end, but I need an appointment with, you are going to hear that from the patient. I need an appointment with cardiology. I need an appointment with gastroenterology. I need an appointment with Dr. Samper. So, necesito una cita. It's very, very common sentence. And somebody's answering here, right? Or beautiful ladies in the front desk. Buenos días. Mucho gusto. Mucho gusto means it's a pleasure, of course. I'm happy to help. La doctora Ambrosio atiende de lunes a viernes. Dr. Ambrosio attends or is open, has openings from, in this case, de means from Monday to Friday. De lunes a viernes. Lunes, martes, miércoles, jueves, viernes. Monday to Friday, lunes, martes, miércoles, jueves, viernes, from Monday to Friday. And also desde, in this case, also desde is from, okay? So in this case, de means from, and desde means from. Desde las 8 de la mañana, from 8 in the morning, 8 de la mañana, 8 in the morning, until, hasta 4 in the afternoon, hasta las 4 de la tarde. So, let's read this. La doctora Ambrosio atiende from lunes a viernes, from 8 in the morning until 4 in the afternoon. La doctora Ambrosio atiende de lunes a viernes desde las 8 de la mañana hasta las 4 de la tarde. And los sábados, the Saturdays, such a great doctor, Dr. Ambrosio, and the Saturdays from 8 in the morning until 11 in the morning. So she's Saturday's day just from 8 in the morning to 11 in the morning. Okay, do you think that you can tell me, writing maybe in the comments, from which time to which time she attends Monday to Friday? Maybe you can tell me what's happening or what's her schedule on Saturday. Let's see the next one. So we are going to be using some colors And in the next session, we are going to do a bonus, some colors and some shapes. We use that a little bit, but I think it's going to be important for you. Thank you very much for listening this very short presentation about the numbers for Spanish for medical professionals. I am preparing, I am getting ready, because tonight we are going to be completing our Spanish for medical professions 3 and 3. That is going to be discharging the patient. Remember, last time we did it about the medication. Now we are going to be doing about discharging the patient. So I'm getting ready. See you in a couple of hours.